Hi, I'm Shirley Tabb, and welcome back to the Case Manager Show. I am Shirley Tabb, and I'm a social worker, and I'm proud to be a social worker. And today we're going to talk more about the DC Medicaid waiver program, because did you know that people have a right to age in place? And what we mean by aging in place is simply people have a right to remain in their homes and in their communities where they can get home health services, personal care assistance services, and through a program called the Medicaid Waiver Program. Some people call it the EPD Medicaid Waiver Program, and the EPD stands for the elderly and persons with physical disabilities. That's all it means. And it's a federally funded program that's also co-funded by your DC government. The federal government pays 70% and the District of Columbia pays 30%, because the district government officials want people to be able to stay safely in their homes and communities after they have had a catastrophic illness, perhaps a stroke, or untreated or uncontrolled diabetes, and many other chronic illnesses that require personal care or assistance. And in some cases, people end up going to institutions such as nursing homes. But research has proven that we do better when we are able to live at home. The gross income for an individual who would want to come into the Medicaid program is $2,020 for a single individual. And if it were a husband and wife, and yes, I have assessed many husbands and wives, couples where both of them have become weak and debilitated, and they need personal care assistance and other components of the Medicaid waiver program in order to make it easier for them to remain home when they don't have caregivers able to provide the level of care that they require. If it is a couple needing the care, then the couple's income must not exceed $3,033 a month gross. Now, when we say $3,033 a month gross, we are meaning before any tax is taken out. And a lot of people ask me, well, Ms. Tabb, does this mean that the government will allow for the rent that I'm paying? Or do they consider the mortgage that I'm paying? Do they consider my property tax? No, right now they don't consider your property tax. But this is something that perhaps you might want to write your elected officials about. As a social worker, we do hope to begin some advocacy in this area, because people are expected to live within their incomes, but yet, and they are held accountable for the income, and those expenses such as the mortgage and taxes, they are not considered when you are being evaluated for the program in terms of your assets. You may own your own home and you can own a car. However, you may not have more than $4,000 in the bank if you are a single individual, and if you are a couple, you may not have more than $6,000 in the bank. And this is a problem for me, because if we are telling people that they are able to qualify for this program and own a home, then it's just impossible to think that someone can own a home and have less than $4,000. If the roof flies off your house and you only have $4,000 that you're trying to live out of, that's going to be a problem. And there are not enough government resources to take care of everybody's roof. So that's why we must advocate around this issue, and we must ask our government officials, our elected officials, to look at this asset requirement again. And I think it could be a matter that nobody has brought this to the attention of elected officials, because obviously they care about the citizens in the District of Columbia, because they do make this program available, and it's a wonderful program. But we want more people to qualify, and we don't want to put people in difficult positions to qualify for the program. We don't want people to become destitute to qualify for this program. The process, you might wonder, well, how do I qualify for the Medicaid program? Well, you can call me first of all, and my phone number, you can reach me at 202-289-1923. We will put the number up on the screen at the end of the program. All of my contact information will be there. And it does not need to be me necessarily. There are other agencies in the District of Columbia who provide home health assistance. There are some very good agencies, but you do need to select a home health agency, and then they will send a social worker or a nurse or a case manager out to do an assessment to make sure that you qualify for the program and that you meet the asset requirements. And then your doctor will be sent what's called a level of care form. And then that doctor is required to sign off on the form, indicating that he or she agrees with the medical assessment that has been done by the case manager who is doing the Medicaid waiver assessment. Once the doctor signs off and we are all in agreement, then we send it to a company called the Delmarva Foundation. And the Delmarva Foundation looks at that level of care to see just what you need in order to remain in your home. And then they will either approve or deny the level of care, certifying your medical eligibility. And your doctor has signed off on it. There is no reason, if we've done a good assessment, there's no reason you will not get your eligibility certified. And then it goes back to DC government. It goes over to the Income Maintenance Administration, where they will then approve the Medicaid, your Medicaid status. And you have up to 45 days for Income Maintenance to approve your Medicaid. And they will send you a letter letting you know whether or not you have been approved. And then you will get, after a few days, you will get your Medicaid card. And that's really great, because when you get your Medicaid card, you are then a bona fide Medicaid waiver recipient. And then when Income Maintenance certifies or approves your Medicaid, they send it back over to our friends at the Department of Healthcare Finance. The Department of Healthcare Finance is the DC government agency which has oversight for the Medicaid waiver program, and they also have oversight for the Children's Health Insurance Program. Some people call it CHIP. And then prior authorization number is issued by the Delmarva Foundation, and that prior authorization number is like an invoice number or a billable number, and that's the number that allows the home health agency to provide care for you and for the government to reimburse the home health agency. And it sounds like a long process. It is rather a lengthy process, but the case manager is responsible for following through on that case, on that assessment, to make sure that it goes through all of the steps. There are sometimes, as in any systems, where there could be a step could get missed. But if you stay in touch with your case manager is then able to contact Healthcare Finance, the Department of Healthcare Finance, to find out exactly what is going on. And if you've had an assessment and you haven't heard anything in 45, or especially if it's getting around 60 days, then you should call your case manager and find out what is going on. And always, please, always get a telephone number for the agency and the case manager who comes into your home. Many times we have people who allow people to come into their homes. They don't get business cards, they don't get phone numbers or anything. So that can be dangerous. Know who you're letting into your home. So we want you to be safe. We're going to take a station break right now, and I will see you in a few moments, and we'll talk more about your right to stay home and get personal care assistance right in your home. We'll see you when we get back.